you're going to learn the basics of that very language. Okay, before we can describe any movement, we need a universal starting line. We all have to be on the same page, and this is it. The anatomical position. Standing up straight, feet parallel, and here's the key part, palms facing forward. It's our reference point. It doesn't matter if you're talking about a movement you do while sitting down, everything is described as if it starts from this one pose. It's basically our Rosetta Stone for the body. Let's start with the most fundamental words in our new vocabulary, the simple acts of bending and straightening. These are the absolute building blocks for so much of what our bodies do every single day. It all comes down to the angle of the joint. Simple as that. When you bend your elbow, bringing your hand toward your shoulder, you're decreasing that angle. That's flexion. And when you straighten it back out, you're increasing the angle. That's extension. It's really that easy. Flexion bends, extension straightens. But what happens when you go too far? Well, extension is straightening, but hyperextension is when you push a joint beyond its normal healthy limit. A whiplash injury is a perfect, though really unfortunate, example of this. The neck is violently forced into hyperextension. So you can see why making that distinction is absolutely critical in a clinical setting. Okay, let's move on to our next pair of terms. These describe how our limbs move in relation to the center of our body, what we call the midline. You could almost think of it as the body's social dynamics. Are we moving closer to the group or stepping away? When you lift your arm out to the side, you are abducting it. You're moving it away from your body's center. And here's an easy way to remember it. Think of aliens abducting someone. They're taking them away. Then, when you bring your arm back down to your side, you're adducting it. You're adding it back to the body. So abduction is away, adduction is toward. Our bodies don't just move back and forth or side to side, right? We rotate and we twist. So this next set of terms is all about that rotational movement, especially in our arms and legs. Imagine you're standing up. If you rotate your entire thigh so that your toes point inward toward your other foot, that's medial rotation because you're turning toward the middle. Now, if you rotate it so your toes point outward away from your body, that's lateral rotation. It's all about twisting toward or away from that center line. Now, our forearms have their own special kind of rotation. Hold your arm out in front of you. When you turn your palm so it faces up, like you're about to receive something, that's supination. Now, turn your palm to face down, like you're about to type. That's pronation. These are two simple opposite movements we do all day long without even thinking about it. And here is how you will remember that forever, I promise. To hold a bowl of soup, your palm has to be facing up, right? You need supination to hold your soup. There you go. You'll never mix those two up again. Okay, let's travel down to the very foundation of our bodies, our feet. They have their own unique set of movements that are absolutely critical for balance, walking, and, dealing with uneven ground. If you tilt your ankle so the sole of your foot faces inward toward the other foot, that's inversion. And get this exact movement is the cause of the most common type of ankle sprain. The opposite move, turning the sole of your foot to face outward, is eversion. Let's think about driving a car for this one. When you press down on the gas pedal, you're pointing your foot and toes down. That's plantar flexion, like you're planting your foot. When you lift your foot off the pedal, pulling your toes up toward your shin, that's dorsiflexion. There's actually a condition called foot drop where someone can't do this, and it makes walking incredibly difficult, which just goes to show how vital this movement really is. Okay, you've learned the essential words. You have the vocabulary. Now let's see how they all come together in a kind of grand finale, a single, fluid movement that combines many of these terms at once. This move is called circumduction. It's the combo move. Imagine swinging your arm in a big circle. To do that, your shoulder has to move through flexion, abduction, extension, and adduction, all in one smooth motion. It's the ultimate compound movement, and it's a perfect example of how these simple actions work together. And here it is, all in one place. This is your cheat sheet for the language of movement. Just look at the pattern here. Flexion and extension are opposites. Abduction and adduction are opposites. Every single key movement we've talked about is part of a complementary pair. This is the core dictionary of how our bodies move. So why does all this matter? Why learn this language? Well, because it removes all ambiguity. It creates a shared, precise understanding that lets a therapist in one part of the world know exactly what a surgeon in another part of the world observed. It's the foundation for everything from diagnosis to rehab. And ultimately, it's the difference between guessing and knowing. So the next time you stretch or even just reach for a cup of coffee, take a moment. You now have the vocabulary to describe precisely what your body is doing. You can speak its language.